Aloha, and welcome to another episode of the Weekly Wellness Show. And this is my episode to rant. All right, so we're 4 months into this coronavirus pandemic? I think maybe even 5. Let's see. Tomorrow's August, so we're looking at mid-March, April, May, June, July. Okay, 4.5 months, right? Since things got shut down, we started the quarantine processes across the United States. We started all kinds of things, and we're still dealing with it. Okay, we're still dealing with this. And, I like to say in certain places they've gotten better, in certain places gotten worse, but I don't know who to believe anymore. I don't know about you. I've been a chiropractor. Just to kind of share a little bit more about me, I've been a chiropractor for 25 years. My focus in practice now is on weight loss and nutritional consulting. So I do a lot of work in, I run lab work. I look at all kinds of systems in the body, particularly the immune system, okay? All right, and especially in the past few months, we've been focusing on helping people boost immune system, especially those who are possibly immunocompromised or who have comorbidity factors, like maybe they're dealing with diabetes, high blood pressure, heart disease, maybe can be anything, right? They're dealing with a virus or what have you. But I'm at a point now where enough is enough. I'm just not buying this. I'm just, I've been tested, just so you know, full disclosure. I had my antibody test done. If you give blood at a blood bank, they'll test your antibodies for free. Okay, and I was always wondering about that because, how are they supposed to find out if the blood sample's safe or not? So I've had my blood tested that way. I've even had my blood tested independently for antibodies from another office that had a phlebotomist on staff. So I've done that too. And these are labs run by LabCorp that give these results. Okay, LabCorp, just so you know, across the country is one of the oldest, most common labs that a lot of facilities use, including doctors like myself. So I even had my corona test done, the one where mine wasn't the brain scraping one, okay, but they did get a sample from within my nose. It was harmless. There was no pain. It was actually really comfortable. It literally took, the doctor to basically put like kind of a swab or a Q-tip around my nose for like 20 seconds on one time, 20 to 30 seconds on the other, and then I was done. And I got those results within 3 days, and that was negative. So I'm very grateful for that, because a lot of times, we do our diligence in the office to do our best. We're around people, whether I have a mask on or not, whether I'm outside the office, inside the office. I see people walking around with masks on. I still nod my head why they're doing that. It's when you're outside, you're outside. If you're in clusters of people, I totally understand that. But even so, this is the point I'm getting to. It's been too long. 4.5 months now. This is ridiculous. We're looking at all kinds of things in this. Is it politically, swayed? Is it this? Is it that? And I've had enough. I've just had enough of this. And we have medical doctors, okay? These are the quote-unquote real doctors, all right, that are going to Capitol Hill, putting their heart in their sleeves saying there's a cure, and it's called hydroxychloroquine, all right? And also, in very low doses and preventative doses. And we're talking about, I was looking at the data on this, it's 200 milligrams a tablet twice a month as a preventative dose. And this could end people having to wear masks anymore in the United States. Children shouldn't be wearing a mask. God, they got an immune system like no one else's. But this is where it's getting ridiculous. And, there's these doctors that are saying, they have prescriptive rights, right? Now, as a chiropractor, I don't. That's for a reason, okay? And I choose that. That's why I am a chiropractor by profession. But, the medical doctors, they have prescriptive rights. And their prescriptive rights are being upheld to prescribe hydroxychloroquine. CVS is doing this. I'm calling out CVS. You guys are on the take. Who's controlling your back pockets, to prevent other doctors from, basically prescribing something that is relatively inexpensive? Oh, did I say a word there that might trigger some people? Because it's so inexpensive that we have to stop prescriptive rights for that because that drug isn't expensive enough for other people to profit on, And that's where we're getting at is, a lot of these doctors, they're in practice, They could have, worked in, big practices where they could have made a lot of money, but they'd be practicing like they're in a box, like for every sign and symptom, someone comes in, all right, here's your drug, get out of here, see you later, bye. Good luck, may the force be with you. But these are doctors that are very well educated, that have a heart, and they want to see people get well. They want to see people get cured. So, and this has been going on for months, that this hydroxychloroquine is the answer. They're using it in other countries where it's over the counter. What's the deal? Okay? Now, there were studies that said if you take 4 times the amount, you're going to possibly lead to a cardiac arrhythmia. Well, that's with anything. If you take 4 times the recommended dose of any kind of drug, there's going to be bad things happening. I don't care what it is, all right? But with hydroxychloroquine, they're just mentioning like twice a month, a 200 milligram tablet. That's nothing, okay? So let's take a look at this. Who's benefiting from this? Who is who's preventing this? Who is taking down these doctors, these medical doctors who go to some of the best schools in the country, Harvard, Stanford, wherever? Why are their videos being, shunned or taken down from YouTube or Facebook or whatever? Who is censoring this stuff? Who has the right to do this? This is supposed to be the home of the brave and the land of the free. We're not feeling so free right now. And I'll tell you what, a lot of people are not feeling as brave as they used to because they're seeing how they're just being just crumpled little by little. Our rights are being stripped away one at a time for the good of mankind in this pandemic that we're experiencing. Give me a break. I mean, San Mateo County, where I'm in right now, is under a 3-day watch list. So today's Friday, we're on, I think, day 2. Tomorrow, if they're not seeing an improvement in numbers of people being positive or what have you, they're going to shut down the economy here again. They're going to shut down the quote-unquote non-essential businesses, the hairdressers, the restaurants, the dining. I mean, it's like we've done what we needed to do here. It's not as bad as we think, and we've all had enough. I've had enough. I think this is ridiculous. I think this is all about money. I think there's the powers that be are. Let's put this into perspective, right? If you're at a doctor's office and you get diagnosed by that doctor, or in a hospital setting or wherever, that's a $13,000 frickin' diagnosis. $13,000 to say, well, the diagnosis is COVID. Yeah, okay. And then if they ventilate you, that's another $39,000. Now that's the Medicare rate. Okay, that's the low end. All right, that's the Medicare rate, the low end of that. So if they have other different kinds of insurance, like maybe like a United Healthcare, a Blue Cross, a Blue Shield, Aetna, Cigna, something like that, those insurance companies, with those kinds of insurance companies I just mentioned outside of Medicare, you're allowed to bill 2 to 3 times the Medicare rate. 2 to 3 times. All right, do the math. That's a lot of freaking money. And then let's also talk about the cure, right? The vaccine. And honestly, that's the end game for this. Nothing's going to change, especially in this country, until there's a vaccine. And everyone thinks that they're going to be saved by this wonderful vaccine that they're fast tracking, that normally any other vaccine would take 3 years to make, but they're fast tracking it. So I don't know about you, but I'm not going to be the guinea pig. If I have COVID or whatever to get that injection, who knows what's going to happen with that, right? And by the way, I haven't had a vaccine shot or any medication put in my body probably since my late teens. I'm 49 years old now, okay? So keep that in perspective. I'm not saying I'm not trying to brag, but, just because you reach a certain age doesn't mean you need to be on medication, all right? That just because you're of Medicare age or soon to be of Medicare age doesn't mean that, hey, the floodgates open so you can be on all these meds now that Medicare or Medicare practitioners get to bill for. All right? No, that's not life. That's called, just living a longer death because you're on medication. All right? Give me a break. So, a lot of things here I'm ranting about. A lot of weird stuff. I mean, I've had enough, okay? I'm sick and tired of seeing people fearing walking in front of someone, giving someone a hug, wearing a mask, thinking they're going to get sick from me, because they walked right next to me. Social distancing, folks, if you want to stay healthy, you got to expose yourself to germs and viruses. That's how the immune system works. That's how it works, okay? If you hide, shelter, put this Purell all over your hands, your body, your face, whatever, 3 to 5 times a day, guess what you're doing? You're actually making your immune system not function as well. You're giving it an artificial way of staying healthy. We're not designed to put this stuff all over us. And I'm really curious, like I said, soap and water is all you need to do with your hands. Just wash them. It's simple hygiene. You don't have to go to such extremes. I mean, even at the airports, I can't believe all the Purell or, antiseptics or antimicrobial things. I actually collected a bag of them from the different flights I was on, And what's this world gotten to? And we're going to be pretty soon. I mean, it's just bad. This isn't good. All right, and we need to start waking up. We need to start questioning people. We need to start wondering, why is this happening? These outbreaks aren't happening because we're not wearing a flippin' mask. All right, give me a break. They're happening for other reasons. Part of it's because more people are getting tested. Hell, I didn't get tested until 2 weeks ago, and this thing's been going on 4 months. A lot of people are now getting tested. There's more opportunities to get tested. So we are going to see a different side, but it doesn't mean you need to have a ventilator shoved down your throat. It doesn't mean you're going to be like this, you're so bad that you're gonna cause this other pandemic. You know what it is? There's a part of me that wonders, the ones who do get exposed to the virus, to this COVID, and all they may have is just a little bit of discomfort, or it might be an inconvenience because they got to stay home for a couple of weeks. More power to them. If they have no symptoms and they're just taking care of themselves, guess what they're doing? They're creating their own antibodies. Their immune system's going to get stronger and stronger and stronger because it beat this effing thing, Rather than us trying to avoid it, trying to run from it, trying to hide from it, expose yourself to it. I think, honestly, that's the best way to do it. It's like you can't live in fear. It has never worked in any aspect of your life. If you live in fear, bad things will happen. If you put yourself in a position of power and you take care of yourself, you address your lifestyle, you address what you're eating, what you're drinking, exercise, things like that, then you're not in the crosshairs so much of this stupid COVID virus. It's not about what vaccine you need, it's about what do you need to do now. And there's never been a better time to take better care of yourself than now, and it's never, ever, ever too late to start taking on healthy habits and a healthier lifestyle. Plain and simple. You just gotta take the step, get away, stop watching TV, stop watching the flipping news. Okay, stop watching that. Stop listening to all the garbage that's on there, and start talking to people like us, doctors who actually want to help you live longer, help you live healthier, not only just for yourself but for your family, your kids, your loved ones, your co-workers, people that you're in leadership to. They're the ones that want to see you be on this planet longer than anything. Set the example for them on how to take better care of them. I'm getting comments from my patients left and right that because the moms or dads are taking better care of themselves, the children are now, or teens, are now getting more engaged in their meal programs and cooking, and they can't believe how much better they feel. They can't believe that, wow, they're losing weight naturally because guess what they did? They stopped putting the crap in their body. And that's something my father-in-law always told me. He's a big World War I, World War II fan. And he said, Chris, to defeat the enemy, the best way to do it was to cut off the supply line. Cut off the supply line. If they don't have ammo, weapons, or food, chances are they're going to die, or they're going to be defeated. Well, look what's happened to this planet so far in the last 4 months. I mean, we've had better air quality. Grass is greener, the sky is bluer. And that's what's happening with the body if we allow it to just eat right natural foods and give it a break from the toxins and the sugar that we're giving it. The body has the innate ability to self-regulate and to self-heal, plain and simple. But if we keep putting doses of viruses or vaccines and drugs and everything else, well, how do you expect the damn thing to work to begin with? You never gave it a chance to fight for you. Do you have to take that aspirin if you have a fever? Do you have to take this if you have a cough? Let your body fight. Let your immune system fight for you. That's what every body has, and that's what we need. Okay? So, again, just telling it like it is. Enough's enough. All right? Stop living in fear. Start taking better care of yourself. You're responsible for your health, by the way. You are. You look in the mirror. You're the one responsible, not doctors. You want to better your health. You want to improve your health. You want to just take it to a different level, then you talk to guys like us and we'll help you out to do that. But it's your responsibility. It's not your insurance company's responsibility. It's no one else's responsibility. It's yours. You need to talk and find the right doctors to help you get healthy pronto, okay, like yesterday, all right? And all it takes is one more step. That's it. Take that step, and I guarantee you, your life will be better every day thereafter because you keep taking steps to go in the right direction. And a mentor of mine always told me the difference between winners and losers in life, in anything they're up to, or whatever inspires them in life, is the difference between winners and losers is one more step. Take that step, folks. You'll thank yourself. Your family will thank you. Everyone will thank you. But most importantly, you're putting yourself first. In order for you to help others, get your health in line first so you can help the ones that love and depend on you the most. All right, let's get to work. Mahalo for listening. And like I said, if you enjoyed this rant or enjoyed this video, please, just so I know you're live, hit subscribe down there. And then if you want to get well and stay well, tag that bell, and you'll see me more often than not. But this is again you're going to see a different side of me today, and possibly down in the future too. So I've had enough. I've had enough of watching my friends, loved ones, live in fear, live like, I know people that are still living at home, or not living at home. They haven't left the house, and these are grown men and women. They're scared to death. They actually think that they're waiting for the vaccine. Otherwise, they're just going to stay home and they're going to wear a mask everywhere they go. Come on. The body doesn't work that way. All right? So, love you all. Mahalo. And take care of yourself. Aloha.